This really, really was helpful for me. It helped me become more self-aware, helped me to understand exactly what my needs and goals were in life, where I was stuck, allowed me to actually have healthier conversations, or at least have difficult conversations that maybe I'd been putting off, and really allowed me to face my own mortality to some extent, where I was very much cognizant that, hey, you know what, I'll be okay. If I die tomorrow, you know what, there is something after this.
From Detox House, this is the Find Your Freedom podcast with your host, Aleks. Have you ever imagined the magic that would happen, the world we would live in, if everyone was operating from a physiologically centered place? What if you just gave your body a chance for that? Give yourself a chance as if you were your own pill. You are the medicine. Detox House is a portal for connecting the physical body with the spiritual body. We calm and reset nervous systems through a curated trio of everyday release practices such as breathwork, sauna, and cold plunge. These modalities are made better with a greater understanding of what our bodies are capable of, what we are capable of. That's why we're here, to remind you of your own power and to guide you back to find your freedom. Let's talk about what that means. We don't just want to imagine a world where everyone is operating from a centered place, we want to see it. To find out more about breathwork, sauna, and cold plunge practices, and to get guided doses of all three modalities, download the Detox House app. Welcome to the rebranded Health Accomplice podcast that is now the Find Your Freedom podcast and in an all-new season, with so much exciting new content that I cannot wait to share with you. So this episode kicks off the season and kicks off the new Find Your Freedom podcast and is an interesting one because it's about something that I've been very curious about myself. I personally have never done ketamine therapy, but have had so many friends, clients who have tried it for various reasons to cure their depression, to heal anxiety, just because they're curious. There are some friends that I know that have done it for pain management. There are lots of use cases and modalities, and for the most part, I have heard really good experiences. Full disclosure, I did hear of somebody not having such a great experience. So, as always, take what resonates and leave the rest. Not everything is for everyone. Everybody is so different. We are unique, and what works for one person doesn't work for another. But I thought it would be interesting for me to have this conversation because I'm interested in exploring this modality for myself, just because I am your guinea pig, basically. I love trying new things, especially as they relate to anything mind, body, spirit, optimizing my mind. I'm always working on reprogramming limiting beliefs, always working on optimizing my spiritual practice, my connection with my intuition, and my connection with the body. And I am a big believer. If you've heard this podcast before, if you're new, then you should know I am a big believer that the spiritual body impacts the physical body in a very big way. And for me, I've always thought of ketamine as a really interesting option to explore more of the spiritual body, explore more of what's underneath our subconscious that is running the show, that is running the program that we experience as our life. So today I have a treat for you. It is a conversation with Aneel Paulus, who is an MD and an MS. And he has the most impressive background. He was an instructor of cancer biology at the Mayo Clinic. He's the co-founder and chief scientific officer at Alpha 2 Pharmaceuticals. He's an associate professor of medicine at Mayo Clinic. He is the co-founder and chief executive at West Eastern Health. Aneel is an impressive man with a beautiful perspective on healing, especially when it comes to cancer in particular, but I think our conversation applies to anyone going through a hard time, any diagnoses you receive, anyone going through anxiety, depression, etc. We talk a little bit more about that. So in this episode, you'll get a clearer understanding of what ketamine is and what it isn't. You'll get an understanding of what a ketamine experience would be like, who it's for, and just a little bit more information on Aneel himself, his experience, how he came to using ketamine in his practice. One little nugget I want to share from this episode that Aneel mentioned that I thought was really interesting and is tied to another episode that is being released with John McGraw, an ex-professional football player, now mindset coach, where we talk about identity. Aneel mentioned in this episode how doctors were never meant to share diagnoses with the patients. The diagnoses were meant as an internal tool to come up with a treatment plan. And what it does to somebody's mental health when they do get diagnosed with something, it creates an identity around that. And I won't go further into that because we have a whole episode on that, but I just thought that was an interesting tidbit that he shared that I've always been super passionate about around building identity around diagnoses and what that means. Anyway, so check out that next episode with John McGraw. And in the meantime, get ready for a treat and get ready for a great conversation with Aneel Paulus. Before we get started, I would love for you to just give everyone a quick intro. Your background is incredible. You have really beautiful, wonderful credentials. The Mayo Clinic is, one of the top clinics and hospitals and so well renowned. And your work with cancer treatment and oncology is incredibly impressive. And so I'm looking forward to seeing how all of this blends together. But I would love a quick intro of your background, how you got into medicine as well. And we'll go from there.
So my name is Aneel Paulus. I am a translational oncologist. And what that means is I have an MD, I'm a medical doctor, but I also have training in laboratory-based medicine, and particularly in a field of medicine that kind of sits at the intersection of clinical medicine and clinical application, but discovery, basic science, research development, and preclinical work. So what my role at the Mayo Clinic for many, many years is a drug development lab that basically discovers how cancer cells operate and how they evade the immune system, which was a focus of my lab on immunotherapies. And then to take what we've learned, which is in a lot of times petri dishes, or in some cases, where applicable, animal models, and that's an area that I recognize is a bit contentious, and there's limited value to that we're seeing, but some aspects there is. But to take that knowledge and translate that over to the clinic and be able to apply these discoveries and treatments in human beings. And so I got into medicine after trying to run away for many years. I come from a family of physicians and surgeons.
It's in your blood.
Most of my family, it's in my blood. I was watching videos of cataract surgeries and removals, complicated process called phacoemulsification, when I was probably 11 or 12 years old. So I've grown up in that environment, and it's been an interesting journey on how I landed back into medicine, went into oncology, and then found my way back into what was a passion of mine, and what I really, to this day, has always under the surface made me tick, which is that what makes me tick? How does my brain work? What is consciousness? How does the brain connect to the different facets of my body and the immune cells and now cancer cells? And I've never lost track and gotten out of touch with the field of neuroscience. I watched it from afar, and in the last year and a half, 2 years, it kind of hit home really, really hard when a dear loved one of mine, who is a brother, is a mentor, ended up with cancer himself as an oncologist. And to see that journey, both from what I was seeing physically, what the cancer was doing to his body, but also what it was doing to his mental health, it really, really hit home. So yeah, in the last couple of years, I've kind of invested time back into that passion that I've had to really understand how the brain is the master organ that connects our bodies in this unique way, and there's such a connection which we're just starting to figure out. When people say mind body connection, what does that really mean? I look at it at a cellular level now. Is that what is being done in the brain, how we're thinking, what's influencing our thoughts, and how that translates into secretion of different hormones and growth factors and neurotransmitters that then acts on the immune system and acts on any cancer cells that are around. And any of the foods we intake. It's such a beautiful, intricate, poorly understood system, but I think there's a lot of progress being made in that. So a little bit about me and my background and what my interests are.
Thank you for sharing that. I really appreciate it. Thank you for being so open about the difficulty of your dear friend, getting sick, and you know, experiencing the effects not only on a physical level but on a mental health level. Before we get into talking about, how you've used ketamine in your practice and how you've seen it work, I would love to hear a little bit more about that mental health aspect as somebody who has also witnessed a dear friend of mine who got a very serious diagnosis of 12 months to live. I cannot imagine what that does to the body, but as a downstream effect of what that really does to the brain and to your mental health and to your motivation and to, your will to live. And I'm curious if you have any insight and if you are willing to share, and if not, that's okay. But what your friend went through upon diagnosis, and if we have any insight into what happens to the brain when we get news like that.
I think a lot of people intuitively, not medical professionals, recognize that stress could kill you.
Mm-hmm.
And this is what I witnessed, and it's not just with with my family member and friend, but with other individuals suffering from cancer. And I'll try and unpack this in a couple different ways. So mental health in cancer patients, maybe let's just start there, is unfortunately a very overlooked area. And a lot of times, and from a completely cynical, pessimistic perspective, insurance companies, administrators, hospitals tend to think, well, yeah, they have cancer. Why wouldn't their mental health be poor? And yeah, maybe they're terminal. So how much resource do we really want to be able to put towards this? And that to me is unacceptable. It's unacceptable. Really, where the data started to kind of, I'm a data guy. I look at things in that perspective, and I try and see exactly what's working, what's not, what needs to be, where's the gaps, right? And what I noted is that over time, we've extended the lifespan of our patients because of these amazing cancer therapies that are coming out. So cancers that were a lot of times, you had a diagnosis and it was like, hey, listen, according to the data, literature, you're not expected to live beyond a year and a half, for certain kinds of illnesses. And some of this is intersecting as privately as I can share regarding my family member. But diagnosis as such was given, and similar to what you shared right now, right? So, what happens when a person beats that diagnosis? What happens when now they've outlived that diagnosis and they were told, listen, get your affairs in order. You only have a year to live. But let's say now they're alive 3 years, 4 years. They weren't counting on that. So what I noted was is that patients are living longer, but the quality of their life and their expectations from life, their family members, what was kind of set as like, hey, listen, this person's probably not going to be here after a year, but now that they are there after a year and another year, you think that people were happy. You think that the patient who was given that diagnosis was happy. I'm finding that's not a lot of times the case. And, there's just unique circumstances that have come up where people are just not prepared now. So what do you have? And then again, in a lot of times the scenario is the opposite, where yeah, you legitimately have a year to live. You see the deterioration happening, and now what? How do you prepare for that? So there's a lot of ways to look at this, but what I was able to see is that the quality of their mental health is not improving. Even though lifespan is improving, Mental health is kind of that curve. If you were to draw it out underneath, has been stagnant, and post COVID has actually gone down. So it's this huge discrepancy. And what do we have? We have very limited options. And the contours of depression, anxiety, feelings of hopelessness, feelings of burdensome, like somebody feels like they're a burden to their friends and family now. This is kind of there's a term that we use based off of all the literature. It's about experiencing about 40% of cancer patients. It's called existential distress or existential crisis, where now you're being faced with your own mortality and you're not sure, it's like it could come any day, it could not come. It's very different from the kinds of depression, anxiety that somebody with a non-life threatening illness faces. So they're two different things. And one, it's overlooked. Two, there's really no good treatments for it. It's standard treatment, SSRIs, benzos, yeah, and some psychotherapy around it. And let's hope for the best. And I was not satisfied with that. And again, because it touched home so closely, what I noted is that a causative factor and then something that remained in that journey of this individual was, number one, I genuinely believe stress, lack of sleep, overwhelming stress and lack of sleep were contributing factors to this person's cancer. And number two, then what I was able to see is because the diagnosis, the stress involving that, and how do you manage that to now where somebody is able to live a relatively normal, healthy life and have hope. That's where I think with the medicines that we're going to be talking about, hopefully these alternative plant-based medicines, and some that are not plant-based, but within that alternative category. I think what I found, and I'll kind of stop there for a minute, is that if you can restore hope in an individual and a patient, with cancer, their diagnosis and their overall survival tends to be a lot higher. And there is now clinical data published on this. And so how do you restore hope, right? And that's maybe the area where we can shift gears a little bit as to what are the mechanisms, what's the tactics, and there's a myriad tactics depending on the individual.
A couple of things have come to mind as you were talking. I remember hearing a story about a man who was diagnosed with stage 4 cancer, and he was originally from Greece, and he was living in New York, I think at the time, not important to the story, but essentially what he did when he found out he only had a year to live, his immediate response was, well, I'm just going to go move back to Greece and do all the things I want to do and plant a garden for my wife so that when I'm gone, she can garden in it and there's trees bearing fruit and there'll always be a memory of me, and, spend time with my kids and really just squeeze the most out of life that I can. Long story short, he didn't die within that time frame. I don't know where he is today, but he ended up living for a very long time after that. The cancer was gone and out of his body. And it was almost because he just accepted it and, reduced stress, as you were saying. And I don't know everything that went in. This is just a very high level anecdote. So I have no idea what other things he was doing, if he did any treatments or anything like that. I think the point of sharing the story and why it was shared with me was the importance of mindset when it comes to honestly any health related issue. And I know there are nuances and complications to a diagnosis like cancer, or what my friend had was ALS, or, any health issue where we have to face our own mortality. And some people, even when something small goes wrong with their bodies, they immediately go down a rabbit hole of facing their own mortality. They think, this infection is going to mean that they die. Whatever it is, I think it depends on the person, their reaction, their mindset towards it. And I think that the story highlights for me, something really important, and that is this. I don't know if I think that he must have had hope, but there's also this level of just like acceptance without the depression that comes along with that. And I'm going to be honest, I don't know if I could do that. And I can say here today that I don't know if I wouldn't. I think I would go down a dark hole of depression and loss of hope and fear and anxiety. And I guess my question to you is, it's applicable to cancer and beyond. Anyone going through a difficult time where they lose a bit of that hope and they don't know how to move forward. It's almost like a freeze response. How do you think about, anxiety and depression? And maybe this is where we roll into the use of ketamine, but anxiety and depression exist, and they exist definitely within, in different ways in different people. Everybody has a different expression of it, but they're here and we're treating them with SSRIs right now. But, if anybody has watched Michael Pollan's documentary on how to change your mind, there's definitely a clear indicator that plant medicine is now a modality that we're open to using in treating anxiety and depression. And so I would love to hear from you. It sounds like, you did make that connection. You seem like a very spiritual person to begin with, too, questioning your own consciousness. You mentioned before, which I would love to hear more about too, and to how that plays into this work. Is there a spiritual component to the work that you're doing or not? But can you talk a little bit about how you first, what is ketamine and how did you discover the ability to use ketamine in treating somebody's anxiety and depression, specifically when it comes to cancer, but I think it's applicable across the board to anyone suffering from anxiety or depression?
Sure. And thank you, Alex. I mean, for really kind of opening the box up on the use of these very powerful ancient medicines. And ketamine is not a psychedelic. So let's just first of all dive right into what we're going to be talking about, which is the use of psychedelic assisted therapy. And just full disclosure, I'm not a psychiatrist. I'm not a therapist. I'm just somebody who understands medicine, who spent a lot of time within the field of medicine, looking at, again, the neuroscience behind something and then how it connects to the body in a state of disease. So ketamine is we've known about it for 50 years almost as an anesthetic, and it's a widely used and quite safe medicine. Actually use it for pediatric anesthesia in a surgical procedure. So this is used in children to sedate them while they're undergoing surgery. And there's a very predictable kind of pharmacokinetics to it, meaning like we understand how, the dosing, the depth of anesthesia, somebody goes in, comes out, works. So that's why it's widely used in hospitals. I think at some point people found that, wait a second, people are actually emerging from these anesthetic doses, which is very high, feeling happier. And they're kind of just, if they had something that was bothering them, they kind of report that, oh, wait, I don't really remember that feeling low or down. And just for a week or 2 weeks, I was just floating on cloud nine. I think a lot of people and the clinical then investigational history of that began to really understand like, well, maybe there's some antidepressant properties, anti-inflammatory properties. Fast forward to today, it is something now that there's a substantial amount of clinical literature and studies and trials that have been shown that it works really well in mood disorders. And we're still trying to figure out how. I'm going to back up as to how did I start kind of looking into this kind of rabbit hole. And I'll share that I had my own struggles with anxiety and depression. I was very oblivious to these things. I didn't grow up in a culture just from an ethnic perspective and where I've come from, nationally. Mental health isn't a thing. You don't talk about it, especially there's such a high stigma around physicians and people in the medical field that, listen, you don't talk about your mental health. Your medical judgment will be questioned. You'll come under, some kind of institutional review. Your diagnoses, assessments, and plans will be questioned. So just don't talk about it, which I think is a huge disservice because physicians, the rates of physician burnout, depression, and suicide are much, much higher than the non-medical population at large, much higher. And yet we had no research. So I experienced some of this myself. And it came to a really, really a point where I was just looking at anything that I felt like, okay, what is unique out there in the world that is not going to just numb me. It's not going to just put a Band-Aid on me, and that I'm going to have to take indefinitely, and with either, kind of this ambiguity as to, is this going to work or not? Am I going to be in that 30% of people that this works in, or no, I'm going to be in that 70% who is just going to be kind of trial and error, fumbling around back and forth, and there's just no good way. I stumbled on psychedelic assisted therapy myself, and I had my own transformational journey with a very powerful psychedelic that has tremendous clinical potential just because of how quick it acts and how powerful it is.
Which one would you share?
So it's called Bufo, or 5-methoxy-DMT. 5-MeO-DMT from the originally harvested and discovered out of the venom of the Bufo alvarius toad, but now there's synthetic versions being created just for sustainability purposes. Where you don't necessarily always want to be drawing from an animal of some kind in the wild. I mean, there's challenges with that. But for me, that was transformative. I was already very familiar with the classic psychedelics, such as magic mushrooms or psilocybin. I'd been doing research into those. And, ultimately, it was enough for me. It convinced me, where I felt like, okay, this really, really was helpful for me. It helped me become more self-aware, helped me to understand exactly what my needs and goals were in life, where I was stuck, allowed me to actually have healthier conversations, or at least have difficult conversations that maybe I'd been putting off, and really allowed me to face my own mortality to some extent, where I was very much cognizant that, hey, you know what, I'll be okay. If I die tomorrow, you know what, there is something after this. There is a spirit. I was in touch with my spirit, let's say, my soul, this version of me that was I hadn't seen in 20 years, perhaps buried underneath all of the trials and tribulations of this life, of everyday life. And so I hope I answered one of your questions, that yes, there's a spiritual component to this, a very deep spiritual component.
My question is, when you say there's a spiritual component to this, at the very basic level, my understanding of what that means is that we realize that there is more to this life than the experience we're having in our bodies. Therefore, seeing that and experiencing what is outside of our bodies and beyond, that connection to source, God, universe, whatever you want to call it, oneness, that connection that these psychedelics can bring you to is a reminder of, oh, wait, the idea of leaving this body and potentially facing my own mortality is not as scary as I thought, because I have now experienced something bigger than myself, and what's outside of this is beautiful too. So I don't have to be so scared. Is that your understanding of it too?
Yes, that's in a nutshell. That's what I experienced, and it would take another couple episodes for us to unpack what that really was for me. And it was such a beautiful experience that it allowed me to have this perspective of life, of my own, kind of things that I was struggling with, direction in life, purpose in life. And yes, you realize that there's something much bigger than what it is that I experience on a day to day, in just my everyday life, interacting, with one person here, or the things that we think are the reality of life. No, there's something much greater, much bigger, and there's a common thread that does weave us all together. So an experience of oneness, of love, unconditional love, I think would be the right word, is what I experienced. Something I didn't believe existed. But if one can imagine, I know exactly what I felt. So let me tie that back into now where ketamine comes back into the picture. So what I experienced, I again, it's in clinical trials now. Because of the strength of this medicine, Bufo, it's being examined in opioid addiction, and alcoholism. I mean, really hard to treat conditions. The Navy SEALs have known about it for a long time because of the severe PTSD they experience. So it's been part of a protocol that they have been experiencing for 10 plus years down in Mexico and offshore, because it's just not available here. And nobody knew about it here 10 years ago. But again, this is such an ancient substance that people from other tribes, tongues, nations have known about this. So it is being looked at here. But for me, I was like, okay, what can I offer now? What can I do now that I understand well enough, that there's framework built that would be equivalent from a clinical perspective? Again, 20-minute, 15-minute, let's say an hour max, where somebody is able to experience this kind of or have this kind of an experience, just temporarily disconnect from their all of the depression that they thought that they were just never going to be able to get over, all of the sadness or all of the anxiety, or just that script that was running in their head. That's where I came back and got to understand ketamine a little bit. And I'll confess, I had not tried it myself until I really said, okay, if I'm going to offer this to patients, to clients, I need to understand this myself, and I'm glad that I did. But the way that ketamine works in mood disorders, it's given at a fraction of the dose, very low dose. And I've actually perfected protocols with our team here to be able to give it even lower. And at that low dose, you're not in a fully dissociated anesthetic kind of realm where you wake up and you're like, oh, where was I? No, you're present. If I was to get a little bit more technical scientifically, ketamine will temporarily dissociate your prefrontal cortex and cortex level activities, your thinking, rational kind of brain that's always like trying to kind of figure out, the world around you, from the more primitive or midbrain structures that control breathing, control, your heart rate, control some of those aspects of you that are a little bit more, I would say, hardwired, intuitive, instinctive at a subconscious level. So what it does is it allows you to be in the space temporarily to say, okay, what's going on underneath the surface? What's coming up? And allow you to experience some of these emotions in a way that the brain's not trying to rationalize at that minute, at that moment. It is just there, it comes up, and then it can go away. And you'll have a memory of it. And it'll be associated with some very unique imagery sometimes. And some individuals experiences these this imagery in with their eyes closed, actually, in the back of their mind, that's attached to an emotion. So after the experience, 40 minutes or so, you're out of the experience. It'll take you about a week or so to understand, process that, with the help of a therapist that we have, and to make some meaning out of it and to say, oh, you know what? This is really what I was struggling with for all these years. Or this is what I was struggling with in this last week. And this is, or maybe, this is the diagnosis that I was given that I just couldn't wrap my head around. But now maybe I understand a little bit better that, okay, you know what? I've got this life here. I've got the now, the present here. I've got my friends, my family here. Let me just spend each moment with them, maybe not agonizing over what's to come the next day, but rather just focusing on what's here today in front of me, what the gifts that I have, the blessings that I have, the gratitude that I have. So now we're kind of working backwards to the original question that you had, which is, what is mental health to me? And I'd like to actually just steal a book from Paul Conti, who's a really famous psychiatrist, been on many podcasts. I think he spoke this on the Huberman podcast one time, but I think he said it so well that one of the foundations of good mental health is two things, really. It's gratitude and agency. Gratitude just being like, it's really hard to find people that are grateful for life, grateful for things, to be in poor mental health all the time, right? Chronically. And then the second is agency. Agency is, do I have some control over the day-to-day of my life? Whether it's small decisions, big decisions, is there a sense of agency that I have over things in my life? And sometimes you don't. But in some ways, you do, right? You can choose to be happy. You can choose to look at things a different way. You can choose to spend time here versus here.
I want to go deeper into two of those aspects. And I have more questions for you. I'm going to start with what mental health means to you, because I love that reminder of gratitude and agency. I think that agency is so important. And it's interesting because that is my mission, is to remind people to believe in their bodies, but to really believe in their own power. And yes, there's a lot that we cannot control, but there is a lot that we can. And I think there's this misconception of what we can and what we can't. And I think a lot of people give away their agency and give away their control and maybe don't realize how much power they have. And there's the other side of the coin where there's people who do realize and they don't want the responsibility. The responsibility is too much for them. Like, you are the creator of your own life. You can make these choices. You can choose your thoughts. You can choose to work with you. You can choose to go to ketamine, to a clinic that offers ketamine therapy. You can make these choices to help yourself. And it's just, it's a lot of responsibility. So I have empathy and I honor that too. So in terms of gratitude and agency, for you, how do you live with gratitude on a daily basis, and how do you live with agency on a daily basis? How do you incorporate these two things into your daily life? And then I want to ask you more about ketamine, but let's start there.
Sure. My background is not exactly the kind of traditional route that most people have had when somebody says, "Oh, I'm a physician," or "I come from family physicians." I moved around a lot. I've been through 11 different schools by the time that I graduated high school, in different countries, in fact, several. And it created to some extent a degree of instability, right? And never really had that anchor point where my friends, in middle school were like, or high school, were like, yeah, I've known so and so, and we've been friends since kindergarten or grammar school or whatever. Yeah, I didn't have a whole lot of that. And so I for a very long period of time was just constantly in my own head, feeling like, the underdog, or feeling like, no, life has not always been good to me. Life has been hard. And in many ways it has, just by virtue of where I come from, where I'm a minority within my own country, just by virtue of my ethnicity and the religion that I was born into. My own faith has evolved over time. But I at one point in life, I said, you know what? No, look at all that you have here within this country now. Stop thinking about the past. Stop thinking about the future. Stop trying to create, these simulations, let's call it, of what could happen, right? And just naturally, I'm very, I can be very pessimistic, or I can be a little cynical, and some of that for my job has been very beneficial. Just being in research, being in academia, being in these positions where you really have to be discerning to really, really get to the bottom of something. And so you approach it from a more cynical perspective. But where I was seeing that, I'm like, it's playing into my own personal life now, where I just am not able to appreciate what I have. And one day I just said, look at where you are, look at everything that you have, look at and just sometimes just take perspective and see exactly what's going on in your own home country, in your own country of Pakistan, which is where I'm from. And I have a lot of friends and family still there, and I had gotten reconnected to be with several people from there, and got invited to different universities and places to, that were inviting me to give lectures. And I got to see exactly what people there go through. And I could do nothing, Alex, except just throw my hands and be like, thank you, God, for everything that I have today, here in this country, with my family, with my friends. My parents are still in good health. That's a blessing. I have wonderful, relationships now with people here in my community. I can't say I'm bored or I'm lonely. Like, that's not something to be taken for granted. So for me, when I realized that, I started to develop a practice of gratitude, where there's, in the morning, just sometimes, and not that I'm perfect at it, but when I wake up, I will instantly thank God, and for many people, it could be whatever you want. But for me, I have a personal relationship with God, and I realize that is a very different form of agency that gives me. And I'll just say thank you, God, for my breath in my lungs and the sun that's shining on me. And I get to just go out and do what I love to do, and work with people. And so for me, I think that's really, really fundamental and really simple sometimes, as to, am I just thankful for being here alive today, for the friends and family that I have, the community that I have around me, the support that I have around me, and just the ability to do what I do. So for me, that's gratitude. What else? I think you mentioned agency.
Agency, yes.
Yeah, agency is a tough one. Agency is not something that I've felt, again, for a large portion of my life, and it's been a struggle. And agency involved putting a lot of boundaries in place, with people, that friends, family, coworkers, again, professional, personal. It involves you, what I learned, not necessarily loving yourself more than other people, or thinking highly of yourself. I think that's where a lot of times people who are not familiar with this concept, they're like, well, he's just selfish, right? And I had to kind of step back and say, no, it's not me being selfish. It's me making sure my cup is full so I can then pour out on others. I think once I was able to reframe that a little bit, and really be able to put some boundaries, really be able to stand my ground on certain things in a healthy, respectful manner, I realized that, okay, now I have all of the ability. I have that within me to be able to pour into somebody else from a place of a healthy place, not a place of like, obligation, or a place of need, where it's like, oh, I need something from this person, so I'm going to do this. No, now it's just at my own pace, as in how I feel, and it shows, and it does show to the other person, actually, at a very subconscious level.
I want to take that into the ketamine journey right now, because I think what you have mentioned so far about your experiences with psychedelic medicine and with ketamine, it does offer you a bit of agency as well.
Yeah.
And I think when you described ketamine as the disassociation between the prefrontal cortex and our limbic brain, that really resonated with me because I know that from the work that I do in brain rewiring, for my own work in self hypnosis, all of that I am a big fan of. It's this idea of, when you're 0 to 7 years old, your prefrontal cortex is not online. You are operating from your pure limbic brain, which is technically, and I don't know if this is correct to say, but it is your subconscious. And then your prefrontal cortex comes online, and then you rationalize things, and you're not as creative. And if you look at anyone from 0 to 7, they're so creative, they're so connected, they're so imaginative. There's this like childlike wonder and awe that's in them. And so disassociating your prefrontal cortex, which is almost like the I don't want to give it a bad rep because we need it. It's the rational brain, it's a thinking brain, but there's this like wonder and awe underneath all of that too. But it's also your subconscious, your programming that you were given in childhood, whether that programming is, getting old is not easy, or you are not enough, or people like us can't have, like us meaning family, or whatever it is culturally, whatever it is, the limiting belief that you witnessed, and it may not have to have been said so concretely, but you witnessed this, it all goes into that subconscious. And if I'm understanding correctly, when you're on a ketamine journey, that disassociation allows you to see what's under there, what's under the subconscious that may be driving some of the behavior that we experience in everyday life, but we can't sometimes make sense of it. And I think, talk therapy is beautiful because we are using our prefrontal cortex and we're trying to gain understanding of why it is I got diagnosed with this, and an understanding of the next steps that I have to take, and a more practical application of what we have to do, and or also an understanding of the people around us, our relationships. But ultimately, don't we operate from our limbic brains, and we do everything from that primal part of our brain? And the fact that ketamine allows us to access that should provide us with more clarity as to why we do the things that we do, and what programs may be operating underneath, so that we could use our agency, use the power that we have, and say, actually, I can rewire some of these programs. And if I, can get myself, I would love to have the personality of that guy who went back to Greece, diagnosed with stage 4 cancer. Like, that's the goal for me. If I get diagnosed with stage 4 cancer, I want to have that mindset. I want to, like, what is he doing? What's his personality like? What's in his limbic brain? What's in his, operating system that I may not have? Well, hopefully I have, again, I believe that I have the agency to rewire my brain to have that. And it sounds like ketamine therapy might be a way there. So I would love to dive deeper into that. What happens during a ketamine journey? You said it's about 40 minutes long. Can you take us through step by step? How long is the onset? What do you experience? If you remember it, are you hallucinating? You said it's not a psychedelic. Are you hallucinating? Who should be administering this? Is it a psychologist? Is it a doctor? Who administers this? I mean, I know people who do it. Sorry, I don't mean to say I know people. I've seen people do it recreationally and just do it at parties. And like, I don't know what you're experiencing right now. So I want to be mindful and tell people that it's really best to do it under the care of somebody who knows what they're doing, who knows how to dose you appropriately, who knows how to integrate it appropriately. So yeah, I would love to hear more about, like, step by step, what exactly happens and what's the integration process like.
Thank you for summarizing. Actually, you basically did my job for me. No, your explanation for how it works and what you understand about it is really accurate, actually. And so let's see if we can address some of the more kind of technical and process, what the process is like and what somebody experienced from a user perspective. So ketamine is not a psychedelic, a classic psychedelic. There's a difference in terminology sometimes. Classic psychedelics bind to the 5-HT the serotonin 2A receptor. Ketamine binds to the NMDA receptor and actually has a lot of other downstream effects on the glutamate system. And so it's a different system, but there's clearly some kind of base level, let's say, like between ketamine and classic psychedelics, such as psilocybin or LSD or 5-MeO-DMT. There is some common kind of like platform that they must touch because it can produce a psychedelic like experience, meaning that you see things or you can hallucinate to some extent, right? But I'll share now exactly at what point that kind of comes in and why that's important. So number one, it hits the NMDA receptor, and at the doses used for mood disorders, it can make you have a psychedelic-like experience, and why that's beneficial. Now we're going to talk about that. So, client will come in, and we prep them beforehand. So there is a consult with a therapist who understands and can get to the root kind of cause of what's going on with this individual. If there's a diagnosis, the diagnosis is meant for us in the background. I I actually don't feel comfortable. I don't like the idea of giving diagnoses to people. Just not to go on a tangent too far. But do you know that diagnoses were not meant to be shared with quote unquote patient? They were meant as a shorthand between physicians in the back or the nursing staff in the back to be able to communicate in the least amount of words possible that, oh, here's a constellation of symptoms and signs and what's going on. And be able to just say all that in one succinct kind of, like little heading, a tag, a label, and then be able to refer to that in the background. They were never meant to be shared with an individual and just hang a label on them. So I think that's one disservice that sometimes we do too frequently in medicine. And unfortunately, because the insurance company system, that's how it is. But because of what we're dealing with here, I'm very careful to not necessarily hang a label on someone. It can be very complex, right, what they're dealing with. But there's a consult that gets to the root of that, first and foremost. We determine exactly, well, is this person going to need 2 infusions, 4 infusions, 6 infusions? When I say infusion, for now, I believe that IV or intramuscular ketamine are the ones that have the strongest data for the longest efficacy, right? They're places that offer oral ketamine, and there's value to that. We actually will be able to offer that here as well. But I think for the most part, if somebody's coming in with, let's say, classic example, treatment-resistant depression. So if I was to just stick by the book, that's the strongest clinical evidence. Somebody who has had depression, tried traditional treatments, and now they're like, no, this is not working. Well, that's where ketamine can be really helpful, whether it's cancer or not, right? So we do an eval. We determine that, okay, from a psychological standpoint, this is what we're dealing with. This is where ketamine can help. This is the kind of protocol that we can put them on. And then there's a medical eval done to make sure that there's no contraindications, make sure that somebody doesn't have any kind of uncontrolled blood pressure issues or heart-related conditions. They're not pregnant. And there's very few areas that I'm like, no, this is a hard, absolute no, this person's not getting ketamine. A lot of it can be done with dose titration. A lot of it can be done with understanding, where the person's at. So it's very personalized. And you have to have a little bit of experience with it. So now we've determined that, okay, you're a candidate, you're coming in, and now you're in the chair. So the protocol involves putting an eye mask on you and completely cut off your sensory input from your eyes. Your vision and with eyes open, the amount of real estate and processing the brain takes is immense. And so if we could free up some of that compute power and allow, for you to not be distracted and thinking and, your brain going all over the place from having your eyes open, is immensely valuable. So eye mask, completely cut you off from your vision. And then we have a playlist. Now the playlist, which is audio, it acts as kind of a co-therapist, a co-guide to the journey that you're going to go on. And it's a carefully curated playlist. Involves a lot of musical elements of nature and certain, sounds. And it really does invoke this kind of more, you said limbic brain. I really appreciate that you use that word versus primitive brain. But it invokes, again, some of those more somatic experiences that the limbic brain responds to with sound, and connects you back into your body. As paradoxical as it is, ketamine is a dissociative. There are elements of it that you're very much, in kind of understanding how your body is sometimes there, sometimes not there. And it can give you this feeling of floating outside your body, but the doses that are used, you're able to kind of touch base again by breathing, by kind of tapping your fingers. There's ways to kind of bring you back in. So eye mask on, headphones on, and now you're on your journey. About 15 minutes in with the IV formulation, the kinetics are very predictable, so it's a very smooth kind of journey up the ramp, and where you're now all of a sudden kind of in this space where a lot of times you're going to start seeing imagery kind of pop up, and it's very abstract. There's no way to describe between one person and a second person anything common. It's very unique, very abstract, because our subconsciouses are very unique and think in terms of abstract concepts sometimes. But each of these images, along the music that's there, guides you to bring about emotions. And so there's emotion underlying it. And sometimes it can be wonder and curiosity. Sometimes it can be awe, or sometimes it can be a little bit like, wait, what am I seeing here? What's going on here? I'm not really sure, you know. And sometimes it can be sadness. Sometimes it can be a range of emotions, right? You're getting the person to feel, where maybe sometimes they're not able to even bring up an emotion, bring up a thought, because they're afraid where that thought's going to lead. They're afraid where that emotion is going to lead. So you're able to bring these up. And yet, in that whole experience, an individual is at all the time aware, and we have reassured them from the get-go that, listen, you're safe, you're here. And if any time you need help, there's a little buzzer, there's a little beeper. You're constantly being monitored from heart rate, blood pressure.
Are they talking during this experience? Is the guide, therapist, doctor asking them any questions? Are notes being taken, or are you just kind of experiencing it on your own with the
There's
music?
two ways to do it. So there's two schools of thought, and there's value to where a person is completely on their own, right? And there's no doctor conducting therapy in the session. You're constantly being monitored. Your vitals are being monitored. There's a nurse that checks up in on you, but there's no therapist there. So that's one practice, and that's for a range of conditions that you can apply that for. There's another practice, and again, it depends on the person, depends on the therapist and their evaluation, that the therapist's like, listen, this is actually a great place where I can give them an even lower dose where they're not fully dissociated, and they have the ability to engage and be lucid, and can talk. And in that context, there are different types of talk therapies that there's evidence for, like internal family systems therapy, EMDR to some extent, and a lot of data is coming out that yes, the therapist is there, present, and is able to conduct some degree of talk therapy. So it just depends on the individual, depends on I don't want to say diagnosis, but let's say the underlying kind of constellation of symptoms and how we all think as a team can address this, whether, again, low dose and therapist present, or no, slightly higher dose, no therapist present. And then after, the therapist then gets engaged once they come out of the treatment. So about 30 minutes or so, that's where the individual's at. And, they've kind of gone to the peak, and then slowly, they kind of come back down, gently touch back down, and they'll kind of know when they're out of it. They stop kind of seeing the experiences that they were seeing in their mind's eye, or some of the emotions not coming up as quickly anymore. And so, they're able to feel their body a little bit better. So yes, that's how the kind of journey is for that 40 minutes or so. Once they come out of it, we monitor them for another hour and make sure that they're back kind of their senses are fully engaged. Let's say their prefrontal cortex is able to make sense of, oh, okay, well, this is how far this object is. This is how far I've got to move. Not recommended that that you do this. You drive here. So what our conditions and policies are is that you come here with a buddy system, or there's an accountability, a partner there of some sort, a spouse, a loved one, a friend. And we encourage, you're not lifting any heavy machinery, you're not driving for the next 24 hours. And that's just because the half-life of ketamine is about 12 hours. We want to make sure that, the medicine's not in your system and potentially impairing you. After, for the most part, within 8 to 12 hours, you are 100% back to normal. Very few instances that you're still a little bit out of it and you feel like, I took something. I'm not like Benadryl. It makes you feel like you had a little bit of Benadryl. And that's why we recommend that 24 hours later, you're back to normal activities. After that 24 hours, that's when you engage back with the therapist or the psychologist or psychiatrist. And yes, I highly recommend this is managed by a team of medical professionals who also have a little bit of understanding and have training in some of the holistic kinds of medicines and integration medicine, lifestyle medicine, who understand that this is not just any old medicine that you're just giving someone. No, there's a personal aspect to this. The secret sauce, in my opinion, Alex, and I'm sure you'll agree, is not, this is ketamine is a tool. It's just a tool, amongst many tools that we have in our therapeutic toolkit. The magic and the secret sauce behind any of this is the people that are actually there giving you the medicine. They're prior to that, they're after that. The personality that they have, their warmth, their compassion, their ability to kind of meet you where you're at, language that they use, and letting you share what has come up rather than guiding and constantly, trying to kind of say, well, this is what you should be feeling, or this is what you shouldn't be feeling. No, there's none of that. It's you. This is you kind of trying to figure out, hey, what happened? And if there's a little bit of structure and a little bit of, framework needed, that's where we come in. Again, so trained medical professionals, continuous monitoring, protocols in place, and yet it's a lot of this is still you, as your own healer, let's say.
One last question for you about this process. Well, two really. One is, who is this best suited for? And then two, where can people engage in this with you? Where do you practice? How can people find you? All of that would be helpful to know too.
So I operate a lot of times, again, just my background is what's the level of evidence, for a particular treatment, whether it's traditional medicine, Western style medicine, or whether it's alternative, holistic, Eastern, whatever you want to call it. And, based on all of the evidence to date, treatment resistant depression has the strongest evidence for where ketamine can really, really be helpful, really powerful. After that, and to a large extent, maybe even parallel to that, is anybody with suicidal ideation. Ketamine is a great medicine to be able to talk someone off the ledge and at least get them to just temporarily say, okay, there's options. I don't have to do this. I don't have to take my own life. So those are the two areas where I would say ketamine treatment can be very helpful. And again, there's nuances and there's different areas of those diagnoses or conditions where yes, you're a good candidate. No, we're going to have to kind of rethink this. But by and large, those are two things. After that, I would say there's a lot of strong emerging evidence that's now like being coming online, and more studies are coming online for conditions such as PTSD or OCD. I've seen some really good data coming online, for different types of postpartum depression, anxiety. So I think there's evidence for those. There's evidence for pain. Pain management is actually a very different practice altogether, but a different protocol for ketamine is used for chronic pain patients, patients with fibromyalgia, kind of unexplained pain or unexplained kind of inflammatory related conditions, because ketamine is anti-inflammatory. That's where I would say that these are the areas where right now there's good emerging evidence for. And then if you really, really want to go out there where a lot of people are kind of floating in the biohacking world, longevity science, human optimization, there's some very preliminary evidence and data just leveraging the neuroplasticity window. Every one of these medicines has a window of neuroplasticity where if you can engage someone during that time period for a specific activity, specific task, and have a program developed around it, that's where ketamine is also showing up to say, okay, you want to learn something, you want to rewire the brain a certain way, you want to think about a problem differently, because of leveraging that area again of the brain where now there's all wonder, curiosity, being able to reframe the issue that you're talking about. That's where it's showing up again. That's the kind of conditions, the kinds of people that happy to have discussions with and be able to consult with. My clinic is located in Ponte Vedra, Florida. It's a suburb of Jacksonville, Florida, and West Eastern Health. Come check us out. Doing some really interesting things that I think really go back to some foundational principles of, okay, how can we help people meet them where they're at with their mental health, their physical health, because the two are very intricately linked. Leverage both best practices from Western medicine and holistic medicine, because the two are just synergistic when applied appropriately, and then get people plugged back into community, right? Get people connected with not just themselves, but with each other. I think those are, for me, the kind of foundational principles of mental and physical health.
I love that. That's really beautiful. Thank you for sharing that. And I have learned so much throughout our conversation. I'm so interested in trying ketamine, so it's on my list. I will. Maybe we can do a follow-up episode on my experience. But this has been so helpful, so eye-opening, and just a beautiful conversation to allow people to see new possibilities and new modalities and explore what is possible within, you know, within what's within their control, talk about agency, and how they can have agency over their bodies too. So thank you so much for sharing your gifts with us, for being such a great guest and teaching me so much today. So I appreciate your time, and I will link to all of the resources in the show notes of where people could find you as well.
I so appreciate your time, Alex, and for all that you're doing to be able to just bring people together that have a like-minded approach and or are doing some unique things in their day-to-day life that can help us live healthier, help us live a more fulfilled life, and be grateful for what we have on a day-to-day basis. So thank you.
Great. Thank you so much.